What is going on, guys? Welcome to my channel, HAIRLICIOUSLY. My name is Aaron, and for those who are new to this channel, I had 1,700 grafts via FUE implanted into the frontal portion of my hairline back in November 2016 at Motion Clinic in South Korea. Now, it's approaching nearly 3 years since I've had my very first FUE hair transplant, and I am excited to tell you guys that I am going to be getting a second procedure later this year in November. So yes, the date is confirmed, and I know that before I wasn't really sure exactly when I was gonna end up getting my second hair transplant, but the date is confirmed. It's gonna happen sometime earlier in November, and I will go ahead and talk more about this later in detail in this video. So let me give you guys kind of like a backstory into my whole hair transplant journey and why I decided to do it in the first place. Now, I was naturally born with a big forehead, and it has always bothered me, even during my teenage years before I started receding or seeing any signs of temple recessions or anything like that. And certain hairstyles were just unobtainable since, you kind of have to sometimes have a certain forehead length. With having a larger forehead than most people, I was kind of really limited to just keeping my hair either really long or really short. A lot of times I just grew it out just to cover my forehead. And the first time that I started noticing, I guess, balding on my temples was when I actually grabbed the mirror to see how my hairline looked like. And I can tell that I actually had the typical M shape, the receding temples on both sides. And it wasn't really crazy receding or anything like that, but it was enough for me to tell that I was actually showing the initial first signs of hair loss. There was also certain activities that I've avoided or tried not to do, such as swimming or biking or driving with the window open, since those actually involved exposing the hairline, and I was really self-conscious about it. And when I went to college, my first year, I was living in the dorm, and one of my roommates actually pointed out that I was receding, and I think that was when I kind of really got the confirmation about my hair loss. And as you guys can see, my hair loss isn't really severe, and I was probably somewhere between a Norwood 2.5, not quite a Norwood 3, prior to actually getting my hair transplant. So I wanted to go ahead and fill in the temples on both sides and lower the hairline about 1 to 2 centimeters. That is pretty much what I ended up doing when I went to get my first hair transplant in Motion Clinic. And I did a lot of research prior to this, even years back, but I just didn't have the money. But luckily I did find out about some people that did end up getting their hair transplant done in Motion. So I decided to go on vacation to Korea and also get my hair transplant done at the same time. The whole procedure ended up taking about, I want to say about 7 to 8 hours. And there really wasn't much discomfort other than lying on my back for most of the duration of the procedure. I guess the only really painful part or discomfort, I wouldn't say painful, was when they actually administered the anesthetics into the scalp. But after that, you really couldn't feel anything and everything was just pain-free. The worst thing I think when it comes to a hair transplant is the whole waiting game. I think the worst thing is not surgery itself, but having to wait close to a year to see your final results. And unlike most cosmetic surgery, you can see results in as little as a few days or a few weeks. But a hair transplant is a different animal. It nearly took me about, I want to say at the earliest, 8 months to 9 months, maybe even 10 months to finally see the final results. And some people, like I said, might take longer. Some people might even go up to like 15 months to see their final results. The other worst thing about a hair transplant, especially in the beginning, is when you have to kind of conceal it the first couple weeks, because the recipient zone is going to be really red. It's going to be inflamed. It's going to be flaky. It's going to be dry. It's going to bleed. So in terms of that, I'm not really looking forward too much to my second hair transplant, just because I know exactly what I went through and I would have to go through that all over again. But I am looking forward to adding more density into the existing hairline. And I'm also planning on lowering the hairline just a little bit to reinforce more of the single grafts into the frontal portion of my hairline to make it look more natural. And I also wanted to fill in the temples on both sides, because right now it kind of looks like it's receding just a little bit, and I just wanted to go ahead and fill it in and just bring it down. Temples are kind of designed, I don't know if you guys can tell, but they kind of look like they're slightly receding, which can be totally normal. But I think that it's going to frame my face a whole lot better if I can lower the overall hairline just a little bit. And I know what you guys are saying. A lot of you guys, because I did just, leave I guess kind of like a discussion or comment section stating that I will be getting my second hair transplant soon. And there's a lot of people that ended up saying that, you know, your hair looks good, your hairline looks really, you know, really normal, really natural, but why are you getting a second hair transplant? Now, if you never had a hair transplant, you wouldn't really understand, because there's so many things, kind of get to see all the little things about a hair transplant, all the bad things, you know, the lack of density and all that stuff. And a lot of times your first hair transplant is not going to be what you're going to be expecting. A lot of the times people end up having to go their second time, third time to go ahead and reinforce their hairline with more density. And that's exactly my case. I mean, there's nothing wrong with the hair that I have right now, but it's a lot different seeing this from this video versus actually seeing me in person, and also when you guys see my hair out in the sunlight. It's more of a see-through appearance that I kind of wanted to get rid of, because I wanted to make it look more full. And especially the front of the hairline, there's a lot of multi-grafts in the front, so I kind of wanted to make it look more natural by reinforcing the single grafts. And like I said, just kind of fill in the temples. Unless you actually had a first hair transplant, you're really not going to exactly grasp the concept of getting a second hair transplant. And some of you guys are right, especially if you're balding, if you're suffering from moderate hair loss to more of a severe form of hair loss. You obviously want to be more conservative with your grafts. But in my case, I'm not seeing much hair loss, and I'm going to be 31 soon. You know, that's going to be a risk that I'm going to end up taking, using more grafts. And as far as family history of male pattern baldness, unfortunately, I do have baldness running on both sides of my family. And my dad is currently, I want to say, about a normal 3.5, maybe a little bit of diffuse in the back. But he still has a good head of hair. My grandfather on my father's side was, I want to say, like a Norwood 6 to a Norwood 7. I only saw pictures of him because I've never seen him, and he passed away before I even got the chance. And my mother's side, my grandfather was also completely bald. I guess having a hair transplant, especially with baldness running on both sides of your family, baldness does come from your mom and your dad's side. And so it's always going to be a risk, especially if you have, you know, balding on both sides of the family. The chances of me balding later down the road is greater. But I think, like I said, that's a chance that I'm going to be having to take, and that's why we have certain medications such as finasteride and dutasteride and other DHT blockers that is highly recommended. It's not required, but it's highly recommended after a hair transplant to slow down further hair loss and possibly reverse it. It kind of defeats the purpose of getting a hair transplant if you don't take any preventative measures to slow down further hair loss, since you're going to end up playing a game of constant catch-up, because you're going to keep on receding the areas behind the hair transplant. And eventually you're gonna lose ground, and you're not gonna have enough donor hair to go ahead and fill in the balding areas. The good thing is that I haven't seen much hair loss, like I said, after my first hair transplant in November of 2016, as I have been taking finasteride for the past couple years until I recently quit. If you guys don't know the reason why, I quit because I am trying to have a kid with my wife, and I wanted to get all the finasteride out of my system and start fresh. But I am currently using a caffeine-based shampoo with Eclonia Kava. I did do a video on this. There's so many great properties and also anti-inflammatory properties of Eclonia Kava. And it's also combined with other known DHT blockers. I'm still microneedling 1.5 millimeters using a Derma pen with 5% Minoxidil. About once or twice a week, I do take my vitamins and supplements, vitamin D, pumpkin seed oil. And I'm also experimenting with a topical containing various DHT blockers, natural DHT blockers. So I wanted to see how that's going to hold up. And the other good thing is that I really have thick hair. There's a lot of density in the back of my donor zone, and I really haven't experienced any hair loss since the hair transplant. The second hair transplant shouldn't take more than, I want to say, about maybe 1,000 to 1,300 grafts, since it's going to be more of a touch-up and filling in the density on the existing hairline. But like I said, I would like to get more single hair grafts implanted into the frontal portion of my hairline to make it look more natural. And I think that just lowering it just a little bit is going to make it a lot more aesthetically pleasing. Now, I'm totally fine with the size of my forehead right now, but even this one here, it is still on the bigger side. So I kind of wanted to just, you know, maybe just lower it just a little bit, nothing too crazy. I did do a video on this of drawing, I guess trying to draw my ideal hairline. Probably did this video about a year ago, but if you guys wanted to take a look, you can go through my videos and try to look for it. But I did want to also make the forehead just a little bit smaller. Here's how it looks right now. You guys can't really see the see-through appearance, but when I'm in direct sunlight, you guys will actually be able to see it. So on average, people can get anywhere from 5,000 to 6,000 grafts total via FUE, possibly more depending on your hair characteristics, such as good density, hair diameter, hair texture. So if I were to undergo another 1,300 or even 1,500 grafts via FUE, that means that I've exhausted close to about 3,000 grafts, meaning that I have about 50% left, about 2,000 to maybe 3,000 grafts for another FUE session to use towards my future hair loss. And who knows, by then we might have Dr. Suji with his stem cell replication, but you know, nothing is promised, and until it actually happens, I guess we'll just have to wait and see. And a lot of you guys have been saying, you know, it's always 5 years later. You know, we say that hair loss is going to be cured in 2020. We always push back every 5 years. So until something really happens, I'm not going to bet anything on that. So the other thing that I wanted to mention is I also am probably most likely going to get SMP. Not on the front of the hairline, but more towards the back of the donor zone, since I'm gonna have about 3,000 hair follicles that have been extracted from the back of my scalp. So I think it would be really nice to go ahead and cover up those tiny white holes and make them blend in with the rest of my hair. When I actually went back to California a few months ago to go in and see my family, my mom actually saw some of the dots in the back of my scalp when we went on vacation. And I really didn't know what to, I didn't know what to tell her, so I just tried changing the subject. But I mean, I guess it is still noticeable depending on how low that I cut it. But SMP, or scalp micropigmentation, is going to cover those little dots and actually help camouflage it and blend nicely into the rest of the scalp, so that it looks as if there are no white dots or scars in the back. Some of you guys have been also asking me, am I ever going to consider having an FUT procedure? I'm probably most likely not. I'm pretty sure that I'm never going to have an FUT because, first of all, my hair loss isn't that extensive as far as hair loss, and I would really hate having a linear scar in the back of my scalp, especially if I ever wanted to buzz cut my hair. So FUT is out of the picture. The nice thing about Motion Clinic is that they do give a free touch-up to go ahead and increase your density, and I probably have to pay a little bit more just to go ahead and add in more grafts, especially to lower the hairline about 1 centimeter, but it shouldn't be too much. And I'm pretty happy overall with the results of how the first procedure turned out. So that's one of the reasons why I wanted to go ahead and get my second procedure done there. And if any of you guys are interested in getting a consultation or getting your hair transplant with Motion, just go and send me an email and I will get you hooked up with one of the doctors and they will be able to give you guys a free consultation. If you guys want, you can also send me some photos so I can kind of take a look and assess your hairline or your hair loss and tell you guys and give you some of my advice and suggestion on what you guys should be doing. So that's pretty much it, guys. I am going to get my second hair transplant, and if you guys are interested in finding a good doctor, I do have an ebook that I sell on the top 25 hair transplant doctors in the world. You can visit my website at HAIRLICIOUSLY.com, as well as my microneedling device, my Dr. Pen needles, 1.5 millimeters with about once to twice a week with 5% Minoxidil. Studies do show that you can go ahead and promote hair growth because you are not only increasing blood flow into the scalp, you are enhancing and inducing growth factors and stem cells in the scalp for hair growth. And it also helps increase collagen production. The other thing is, if you guys did want to come with me to get a hair transplant in November, let me know. I will be staying in Korea for about 3 to 4 days. So depending on the schedule that Motion has, if you guys can go ahead and squeeze in a date, then I can be there to walk you through everything. If you guys have any questions, I'll just be there. So let me know, guys. Thanks for watching this video. If you guys have any questions, please make sure to leave me some comments or shoot me an email at hairliciously@gmail.com. And make sure to like this video, and I will talk to you guys next time. Take care.